it's got IBS. And with IBS, you have to go, you can use some aloe vera, but aloe is very drying. I don't really like to use too much aloe through the gut, but the stomach and bowel formulas are all designed to help you with that. And take more of them if you have to, or get you some slippery elm marshmallow teas. You want cleansing and strengthening, whether it's the GI tract, whether it's the kidneys, I don't care where it is. So I would definitely do a stomach and bowel formula along with some lower circulations. You don't want any aggressive bowel formula. You want something that's healing and soothing and strengthening because you have vascular wall weakness, which again, don't forget the parathyroid gland, lower circulation, prolapsed organs, which is for prolapsus or herniated areas. Long story short, 2 years ago I started getting the worst IBS symptoms followed by adrenal crash, and last year I switched to raw fruits, but the IBS pain just changed form, but it is still painful 24/7 no matter what I eat. Alright, so one thing's for sure, see all that orange around your pupil? That's sulfur, and sulfur is a gassy, bloaty, but it's also very acidic. So when I look at your bowel wall, you see, look guys, look at all this white. Let me show you this eye. This is his left eye. See all that thick white stuff? See all this thick white stuff? See the orange here? This is all in his stomach and bowels. It's very gassy, bloaty, very acid refluxy, that sort of thing. And you can't get it out until you get it out. You've got to use GI broom and everything else that's in your stomach. You've got a thick malabsorption ring, bro, because your lymph system is backed up in the wall, so you're getting a burn in the wall of your intestines. Think of it as a garden hose, and all around the hose is all stagnant lymph and sulfur. So you're burning your bowels inside, so that can lead to bowel cancer right there. When you have IBS, that's irritable bowel syndrome, you're going to have malabsorption. Because to have irritable bowel syndrome, what side of chemistry could cause that, guys? Glad you agree. Acids, of course it does. Now, think about this. Don't think it just about the bowel and the garden hose, you know, looking in the hose. Think about the wall of the hose. What makes up the GI tract wall, the small and large bowel wall? That's where the problems are. Now, you can have mucoid plaque, and you can have impactions from diverticulums and things like this. Yeah. That's very easy for diet and herbs to clean out of the body. That's a piece of cake. That's a given. How about interstitially in the wall? How do you deal with that? Well, that's why the GI broom is full of astringents to help suck on those mucosas of the gut. However, you have to think internally, and you have to think, okay, this is the lymph system, so I have to go through the doorway of the lymph system, even though it's the lymph system in my GI tract. So I have to go after kidney and adrenals and the lymph system. And then you'll open up, you'll end up IBS, and you'll get your absorption back. Mucoid plaque is the easiest. I think I discussed this before. Mucoid plaque is the easiest to clean off the bowels. Raw foods can even do that to you. But it's in the wall, and that's the key. That's all the IBSs, all the polyps, all the Crohn's, leaky gut. I mean, this is all in the wall. Malabsorption in the wall. You can have plaque on the wall, and I've seen a lot of colonoscopies, but I can tell you that most of man's problems lymphatic, and that's interstitial, lymphatic, constipation. And that's in the wall of the GI tract, and that's the hardest. So that's why we have the stomach and bowel formulas, the GI broom. That's why we have use lymphatic 1 capsules to draw and pull. Very important, because we have to get that lymph moving. And you want to see mucus in your stools, mucus in your urine, mucus coming out your nose, everywhere. And you deal with the IBS. I can see that. But keep in mind, we talked about the acids in the wall. So get in there and you have a hernia tangled up in the small bowels. Well, first of all, let's go to the hernia. Obviously, there's acidosis present to create a connective tissue depletion, which is a calcium depletion within the connective tissue to herniate the tissue. Now, they could have a parathyroid weakness, but you would always work with the parathyroid. I was diagnosed with irritable bowel syndrome, with diverticulitis. I'm telling you, you just loaded up. You are backed up bad lymphatically. You know, when your adrenals are that low, you can also understand that your lymph system is greatly backed up because your kidneys aren't filtering. You can count on it. I must add that I am always very bloated, no kidding, and very gassy. Probably a lot of sulfur in you as well, dear. So get your stomach and bowel number, whatever will move you, at least the number 3 probably. Tear it up with the GI broom. I do the lymphatic 1 capsules, tear it up with those, and really hit the adrenals hard, the kidneys, and really start moving that lymph and pull all that out. Your bowel pockets might be a parathyroid here too. If you're that low on the adrenals and the pituitary is involved, it could also be slamming thyroid and parathyroid. I'd be considering that. Are you cold? How's your fingernails? How are your varicose veins, spider veins, hemorrhoids, depression? All parathyroid, thyroid. Leaky gut syndrome, stuff like this. True leaky gut syndrome, guys, would be where you perforated the bowel, in my opinion, and now you're leaking into the abdominal cavity. That would be a serious, serious problem. I think the real issue here is where we get this lymphatic stagnation interstitially or in the wall of the gut, and it actually burning you from the inside out. Then we develop malabsorption from that. We develop acid reflux from, a different type of acid reflux from that. We start ulcerating the tissues. We start having the IBSs. We start having the Crohn's. We start having these type of problems, even growing polyps and stuff like that. I would really work on detoxifying my stomach, get our stomach and bowel formulas that will help to clean and get the inflammation out of those tissues. Leaky gut, I think, again, I addressed that this morning. I think more leaky gut is lymphatic problems than true leaky gut. This concept of dumping stool matter into the bloodstream is a lot more serious than a lot of naturopaths. They throw that word out there, but in reality, that's a very serious problem needing surgery. So I look at this as a lymphatic problem, no question. Here's this leaky gut concept where you're dumping, you're leaking undigested foods, or you're leaking toxins into the bloodstream. You know, I don't get into that kind of thinking, because I can tell you, if you have a leaky gut syndrome like that, you're going to be rushed to the OR and you're going to be in serious trouble. Death can result real quick. So this idea that you're spilling off toxins into the blood from the bowel, I don't know how much I get into buying that sort of thing. Yeah, there's probably some degree of that. Worst thing is interstitial lymphatic constipation and inflammation. Your gut starts springing a leak, you're going to the OR real quick. That's all I can tell you. I think you're just a really toxic, you're interstitially lymphatic constipated in the gut wall, probably malabsorbed out of that. You say your eyes are, did I see down here that you have hazel eyes or something? That's chronic bowels. That's just chronic bowels, chronic gut. And you have to back up on that.